Everyone, and welcome to part one of our brand new series. Have you ever actually stopped to wonder how a simple, everyday doctor's visit somehow turns into a fully processed payment? Well, today we're decoding that exact machinery. In this explainer, we're going to dive right into the foundational concepts of the healthcare revenue cycle. We'll be looking closely at the critical behind-the-scenes processes that literally keep the entire medical industry running: medical billing and medical coding.
Here is our roadmap for today's explainer. First, an intro to billing and coding. Second, medical coding, our translators. Third, a real-world example of a bronchitis visit. Fourth, medical billing, the financial conduits. And finally, number 5, the essential code sets.
Okay, let's start with Section 1, Intro to Billing and Coding. To kick things off with the big picture, you have to realize that these two professions are the absolute backbone of healthcare administration. Without them, providers simply don't get paid, and the whole system grinds to a halt. Now, billing and coding are independent but deeply interconnected processes. While people often say them in the same breath, like they're a single job, they're actually distinct professions that just rely heavily on each other. Think of patient registration as the starting pistol of a race. The finish line is only crossed when the provider is fully paid for all the services they rendered. And surprisingly, depending on how complicated those services are, or how claim denials are handled, this cycle can take anywhere from a few days to several agonizing months to complete.
Moving right along to Section 2, medical coding.
The translators. Right after a patient is treated, the medical coder is the very first person to step up to the plate. As our text points out, at its most fundamental level, medical coding is exactly like translation. The coder takes something written in one language, say a doctor's written diagnosis or a messy prescription, and translates it into a standard numeric or alphanumeric code. In this system, every single injury, medical condition, and treatment has a matching, specific code. It's like a giant puzzle.
Which brings us to Section 3, a real-world example using a bronchitis visit.
To really wrap our heads around how this translation works in the wild, imagine a patient walks into a clinic. They're presenting with a hacking cough, lots of mucus, and a fever. First, the nurse interviews them and runs some preliminary tests. Then, the doctor comes in, does an evaluation, diagnoses them with bronchitis, and prescribes some medication. Now, here is where the magic happens. A coder takes every single aspect of that routine visit: the symptoms, the nurse's tests, the actual bronchitis diagnosis, the medication, and meticulously converts all of it into specific alphanumeric codes.
You see, the doctor and the staff record every little detail of the visit. But computers and insurance companies, they don't exactly read messy doctor's notes very well. The coder's entire job is to extract the pertinent data and convert it into a standardized format. Because without the exact correct codes for that hacking cough and the bronchitis diagnosis, the insurance company simply won't know what to pay for. Those codes are literally the fuel for the entire billing process.
And that leads right into Section 4, Medical Billing, Financial Conduits.
So once the coder has successfully translated the visit into those alphanumeric codes, they pass the baton. The medical biller takes those extracted codes to generate the insurance claims and patient invoices. The biller sends the claim off to the insurance company examines it, and then sends it back. After that, the biller assesses this return claim to calculate exactly what portion of the bill the patient actually owes. They serve as this vital financial conduit connecting the patients, the medical professionals, and the insurance firms. And the stakes here are pretty high. If a patient refuses to pay or is past due, the biller might even need to employ a collections agency just to ensure the healthcare provider is fairly reimbursed for their work.
Now, if you were using this explainer to maybe help decide on a career path, pay close attention to this part. Coding is primarily a behind-the-scenes data analysis gig. You're going to spend your time interacting with your computer and medical records. Billing, on the other hand, involves a ton of direct patient interaction. Billers act almost like financial translators for the patient, helping them understand their out-of-pocket costs. That requires immense professionalism and, honestly, a lot of compassion. Because, as the text wisely notes, patients aren't exactly thrilled to talk about unexpected medical expenditures.
Let's head into our final section, number 5, the essential code sets.
So now that we understand the two distinct roles, what exact languages are these coders and billers using to communicate? Well, there are countless codes out there, but our text highlights two primary, absolutely essential code sets you've just got to know. First up, we have the ICD codes, which stands for International Classification of Diseases. These codes describe the why the patient is there, their specific illness or injury. In our earlier example, the bronchitis itself would be an ICD code. Second, we have the CPT codes, or Current Procedural Terminology. These describe the what. what the healthcare provider actually did to fix the problem, like the procedures, tests, and specific services rendered.
These ICD and CPT codes aren't just arbitrary numbers, they are literally the universal common language of healthcare. They connect a small, local physician to massive insurance providers, clearinghouses, and even governmental organizations like Medicare or the World Health Organization. This kind of standardization is exactly what turns a highly personal, unique doctor's visit into a clean, payable claim that the entire system can process without any confusion.
So, we've covered the fundamental differences between billers and coders, looked at a real-world bronchitis example, and introduced you to the massive languages of ICD and CPT. But what happens when just one of those tiny codes is entered incorrectly, triggering a massive, cascading denial from an insurance giant? We're going to tackle the high-stakes world of claim denials in our next installment. Please like, share, and subscribe to Decode Healthcare with Harshal. But before you go, seriously, ask yourself, if the entire financial health of the medical system relies on translating a cough into a code, how fragile is the whole machine? Think about it, and I'll see you next time.